eye health is one of the impairments that have been ignored for a long time. The situation of eye care services in Eastern and Southern Africa, more so when you start thinking about accessibility and affordability. The situation is not good. This is compounded by the problems we have in the region: poor infrastructure, inadequate human resource, inadequate funding for healthcare in general, and inadequate mainstreaming of eye health. You go to rural areas, you go to underserved areas where we don't have eye care services, we don't have professional providers who can offer these services, they cannot be accessed easily. Eye health services are still mainly, to a large extent, found in referral facilities or county hospitals. They are not accessible on the ground. Affordability still remains a challenge. If you think about things like readers, simple readers, they cost about 600 Kenya shillings, which is, you are talking about close to $6. How many people can afford that? Just for simple readers. I'm not talking about spectacles here. So a lot still need to be done to make this affordable. As an organization, we are working with stakeholders, community development partners, as well as government structures on the ground to try and increase access to simple services like screening through use of things like digital technology. And one that is very innovative in that area is called PIC technology, where you just use a simple smartphone to screen for services. What we are doing is good, but we want to make sure that the systems in general, the government systems in all the countries where we work in Africa, East and South, are able to put in place mechanisms that guarantee access to eye care services, allocate resources for it, so that eye health can have the due attention it has. Together we can make eye health services accessible, affordable, and indeed very inclusive.